And welcome back to News 46. Maybe you've heard people talk about the elevator speech as an effective strategy to grab the attention of a prospective employer. Well, using that strategy with your doctor can save your life. Celine McArthur shares some valuable advice from ER insiders on how to make sure your doctor is really paying attention to your medical needs.
This health tip is brought to you by Humana.
Visit our local office in the Pahrump Valley Junction Shopping Center or call 775-727-0871.
A trip to the ER can be scary, but a misdiagnosis can be deadly.
It's so easy for doctors to order a test like a CAT scan or an MRI or blood tests, but it's really important to know why every test is done and what the diagnosis is in advance.
In their new book, When Doctors Don't Listen, ER doctors Leanna Wen and Joshua Kozłowski spell out critical mistakes doctors and patients often make when they fail to communicate.
Telling the doctor all of your symptoms is very important.
Symptoms are important, but Dr. Wen says a patient's history can be even more valuable.
80% of diagnoses can be made just based on your history.
Since you know your time with a doctor is limited, you have to grab their full attention in the first 10 seconds.
Doctors are not listening to their patients. They're hearing the words they say, but they're not really listening.
To get them to really listen, doctors suggest practicing your high-impact story.
For example, I've been so short of breath that I can't walk from my bed to the bathroom without getting very short of breath. That really gets the doctor's attention. And then it should have a couple of short sentences that talk about how they got to where they are and how it's impacted their life.
The added details could prevent a misdiagnosis and unnecessary and potentially dangerous testing. I'm Celine McArthur reporting.
The doctor suggests practicing your story at home, even having it on paper. If your doctor still doesn't listen, get a new doctor.